My name is Dr. Hannah Strom, and I am a pelvic health physical therapist, and I own a practice called Awake Pelvic Health and Wellness in Woodbury, Minnesota. And I'm going to talk about endometriosis, what it is, and how pelvic floor physical therapy can help you. So let's start by talking about what is endometriosis, or endo for short. So endo is a condition in which cells similar but not the same to the cells found in the lining of the uterus are growing outside of the uterus on various organs in the body. And these are often called endometrial like cells or endometrial lesions. And these can be found on the bladder, the bowel, the rectum, also found up in the abdominal cavity, at the stomach, the small intestines, the diaphragm. And in fact, endometriosis has been found on pretty much every organ in the body. And these endometrial cells or lesions respond to hormonal changes during the month and during your menstrual cycle. And they can cause severe pain and inflammation throughout the body. So oftentimes individuals who have endometriosis will complain of symptoms like severe menstrual cycle cramps, pain in their abdominal region or pelvic region throughout the month, not even associated with their menstrual cycle, significant bloating, sometimes even leg pain or nerve pain, and a lot of GI issues and GI distress. And so there's a lot of symptoms that often come with endometriosis. And it's said that 1 in 10 individuals who were assigned female at birth have endometriosis. And it can often take about 7 years for individuals who have endo to get an appropriate diagnosis. So I'm going to dive a little bit deeper into the anatomy of the pelvic floor and the pelvic region to show how endometriosis often manifests in this area of the body. So here I have a picture of the abdominal and pelvic cavity. So in the front, this is like your abdominal wall and the pubic bone. This is your back and your tailbone. And you've got some different organs that live in this area. So in the front, you have your bladder that sits behind the pubic bone and the urethra. And then behind that sits the vaginal canal and the uterus. And behind your vaginal canal and uterus is the rectum, and this stores stool before you go to have a bowel movement. And underneath all of these pelvic organs here, we have our pelvic floor muscles that sit like a sling or a hammock from the pubic bone all the way back to the tailbone. Now with endometriosis, I'm going to draw this in green. Remember, these are cells that are similar but not the same to the cells that are found inside of the uterus. And these endometrial lesions can lodge themselves on any organ, including the bladder, the rectum, between the space of the vaginal canal and the rectum. That's a common area. Dividing the pelvic cavity, and then the abdominal cavity up here, you have your small intestines. Above that, you have your stomach, liver, esophagus, different organs there. Endometriosis can be way up here, all throughout the body. And what can happen is when endometriosis is lodging itself around the tissues in our body, so including the fascia and the connective tissue, even around the connective tissue near our pelvic floor musculature, it can create tension and restriction and almost like adhesions between our organs. So if you have endometriosis around your rectum and vaginal canal, and that is a lot of endometrial tissue, that can create pain, restriction, and adhesion at that area, or adhesions at that region. So when you go to have a bowel movement and the rectum stretches here, that can be very uncomfortable for people. And our organs in our body are meant to slide and glide across each other with ease. They're meant to move and have a lot of good just general mobility when we move our body. So that way they can get blood flow and hydration and just stay healthy in general. So now we're going to talk about how pelvic floor physical therapy can help you during your endometriosis journey. I would like to say that endometriosis cannot be cured by physical therapy. To actually remove endometriosis, you would have to work with an OB/GYN who is specially trained in the treatment and the excision of endometriosis. So you would want to find someone in your area or your region of the country who is skilled at both diagnosing and fully removing endometriosis. However, pelvic floor physical therapy can be extremely helpful during any part of that journey, whether you've had surgery or not. So what pelvic floor physical therapy does is we look to help all of the different symptoms that come along with endometriosis to help significantly reduce those symptoms. So some really common symptoms are painful sex, severely painful periods, bowel movement pain, or constipation, IBS, diarrhea. Sometimes there can be things like low back pain or hip pain or leg pain that might be coming from tension in the fascia or the nerves or the muscles around your pelvic and abdominal region. As a physical therapist, I often see people for years, they've been having so much pain in their abdominal wall, so they're kind of in this like hunched over tight position in their spine and their abs. And so there might be a lot of restriction in the spine as well as the trunk. Some other common things that come up for people are difficulties with having a bowel movement or pain when they urinate. And so our role is to take a look at the muscles of the pelvic floor through a pelvic floor muscle examination and help treat any tension or tightness at those pelvic floor muscles. Typically, there's often some difficulty with motion and mobility at the organs of your abdominal and pelvic cavity. So we can do different treatments to help those organs slide and glide and move better so that way you can also feel better. A lot of folks will have pain with sitting or exercise. So we're helping you find relief in your daily activities, working on improving tolerance to different exercises, strengthening and sitting. And so often, one of the biggest components is the pain management side of things. And so a big part of what we're helping you learn are different self-care strategies, like massage techniques on your own body, different techniques like stretching or yoga, mindfulness and meditation, because so often there can be a lot of stress or anxiety that come along with endometriosis. So working on the mind-body components can be a really helpful tool for people. So there's a lot that we can do to help you with endometriosis. And at Awake Pelvic Health and Wellness, we have a really full and robust program for physical therapy for folks managing their endometriosis journey. So always starting out with an initial evaluation to dive deep into your story and your history and go through a thorough hands-on assessment so we can find the areas of your body that are tight, tender, and restricted and start to give you tools and treatments to help that. And then we go through each visit, each follow-up visit, more tools and strategies that you can utilize on your own and a lot of different hands-on therapies here in the clinic. So please do not hesitate to reach out to learn a little bit more about our approach to endometriosis, or if you need help finding a local physical therapist in your area. Thank you.